Dr. Alan Christensen here. And I want to tell you all about the joys, or maybe more so the tribulations of andropause. So women have had this big change that everyone's known about called menopause. They have menstrual cycles on a regular basis. Right around age 50, for most women, they stop. And once there's been no menstrual cycles for a calendar year, it's not common to have any more. So we say there's been a menopausal change. So guys, we go through a similar hormonal decline at a very similar age. So we have a big peak in our hormones around adolescence. We taper the rest of our lives. Somewhere around mid-40s, many of us take a really big drop, mid-40s, mid-50s. Here's something you may not hear. It's getting worse. So the age at which we have a hormonal decline and the amount of decline that we have has been worsening dramatically over the last few decades. We think that it's because of persistent pollutants in our environment, pesticides, plastic byproducts. This affects how we make hormones. It also affects our sperm production. Right now, if you check how many healthy sperm cells the average college guy makes, and you compare that to what the scores were 30 years ago, this is pretty scary stuff. It's about half of what it was 30 years prior. And there's been a steady decline between then and now. And after we're past our reproductive years, that same change means that we have a lot less of good, healthy hormones to keep our bodies strong. There's now irrefutable data saying that men that have the biggest hormone decline have the highest rate of death from a big variety of causes. That includes diabetes, heart disease, and some types of cancers. So it's not just about short-term gains like energy or muscle mass or libido. Those things are valid, but it's also about just staying healthy and staying alive. You see, the hormones that allow us to reproduce mean reproduce on a big scale, like make babies, but they also affect how we reproduce on a small scale, and that means makes new cells. So we're always losing cells that make up our connective tissues, so if we're making new ones at a fast enough rate, we can keep our muscle mass and keep our organs healthy and keep a good immune system. But if we're not making them fast enough, we fall behind in all those areas and aging sets in and we feel a whole lot worse. So that's andropause. It can be a tough thing, but there are safe ways to help your body produce hormone more effectively or make up for the lack if it's really dropped off.